Hi there. Today, Gasper and I are going to do the upper extremity with you. And as before, we are going to follow the document that you've all printed out. The first bone that we are going to do is the clavicle, the one bone which is placed horizontally in the body and is subcutaneous throughout. So this is the clavicle, and this is the medial end of the clavicle, and this is the lateral end of the clavicle. This is the shaft, and notice how it is curved, convex in its medial 2/3 and concave in its lateral 1/3. This is the sternal end, this is the acromial end, and the acromial end articulates with the acromion at the acromioclavicular joint. This is the scapula. This is the concave surface of the scapula, and this is the posterior convex surface of the scapula. This is the superior angle, the inferior angle. Again, if you look, this is the superior angle up here, the inferior angle, the medial border, and the lateral border. This is the lateral border. And then the head of the scapula, this area here is called the head of the scapula. It has this glenoid cavity or glenoid fossa which articulates with the head of the humerus. So if you look here, you can see it's articulating with the head of the humerus. And I can place the humerus too. You can see it articulates with the head of the humerus. The neck is inconspicuous, very, very narrow. You can barely see it. This area is the neck of the scapula. And then this is followed by the body, which is very thin and translucent. In a real bone, you can actually see through it. It's so thin. I mean, you know, in certain areas, it's very, very thin. This concave aspect is also called the subscapular fossa because there is a muscle by that name. And on its posterior aspect, we have two fossae present, divided by a bridge of bone which is known as the spine of the scapula. The part above is called the supraspinous fossa. The part below is called the infraspinous fossa. Medially, the spine is, this part medially is related to the T3 vertebra. This part here is related to the thoracic 3 vertebra in the anatomical position. The processes we see in the scapula are the coracoid process, which is a sharp beak-like process, and then a flat acromial process. This acromial process articulates with the clavicle at the acromioclavicular joint. The next bone is the humerus or the arm bone, and it has an upper end, a lower end, and a shaft. At the upper end, we have the head, which articulates with the glenoid cavity forming the shoulder joint. Then we have the greater tubercle, the lesser tubercle, and the intertubercular sulcus. This is the intertubercular sulcus, this part here, the intertubercular sulcus. Between the head and the tubercles, this is the anatomical neck of the humerus, the anatomical neck. This here is the surgical neck of the humerus. This part here is the surgical neck of the humerus. We call this the surgical neck not because it fractures frequently, but because you have important structures related to that part. You have the axillary nerve and a branch of the axillary artery related on its posterior aspect. So should this area fracture, often surgical intervention is needed because those structures may be involved in the fracture. So that's why it's called the surgical neck of the humerus. And it's very important to know the names of these branches of the nerves and vessels. Then here we have the body of the humerus or the shaft of the humerus, and on its lateral aspect you have there is a V-shaped area which is rough, and that is known as the deltoid tuberosity. That is the area where the deltoid muscle, this muscle of your shoulder, that's the area where that muscle inserts. On the posterior aspect of the humerus, and this area is better felt than seen, on the posterior aspect of the humerus, going from medial to lateral side in a downward direction this way, is a sulcus or a groove present, which is called the radial groove. And the radial nerve and the profunda brachii vessels lie in this area. So fracture of the shaft of the humerus will involve the radial nerve and these profunda brachii vessels. At the lower end of the humerus, on the medial side, the trochlea, which articulates with the ulna, the trochlear notch of the ulna, and above this is the coronoid fossa, which during flexion the coronoid process of the ulna fits into it. This is the capitulum. Above this is the radial fossa. So we have the radial fossa and the capitulum articulates with the head of the radius. And in flexion, this head fits into the radial fossa. Posteriorly, this is the olecranon fossa, into which this olecranon process fits in extension. In flexion, the process comes out. Back to the anterior surface. On the medial aspect, you notice a sharp projection. This is called the medial epicondyle. And this is the part you can feel on the medial aspect of your elbow. Laterally, a much smaller process called the lateral epicondyle is present. The next bone we are going to look at is the radius, which is the lateral bone of the forearm. So it's present on the lateral side of the forearm. And it again has an upper end, a lower end, and a shaft. The upper end, the head of the radius, is disc shaped. It looks like the top of a screw. So this is the head of the radius. This area is the neck of the radius. And below that we have the tuberosity of the radius, where an important tendon called the bicipital tendon or the tendon of the biceps brachii muscle inserts. This is the shaft, and then you can see it increases in size from above downwards, and its lower aspect is flattened out. This shaft has many borders, and the medial border is sharp, called the interosseous border, because when this radius articulates with the ulna, forming the radio-ulnar joints, these two bones are connected to each other by an interosseous membrane which passes between the two bones, keeping them close together. The membrane is also important because it helps to transmit the weight from the radius to the ulna, since the ulna does not participate in the wrist joint. Lower down, the ulnar notch, where it articulates with the head of the ulna, and laterally we have a styloid process. So this is a styloid process, and this forms a projection on the lateral aspect of your wrist. Inferiorly, the radius articulates with the carpal bones at the wrist joint. So it participates in the wrist joint. The ulna is the medial bone of the forearm. So it's on the medial side, and it is the longer of the two bones. So if we put these two bones together, we can see it's the longer of the two bones. One very typical feature of the ulna is when you look at it from the side, you can notice this C-shaped appearance. Plus, it has this little hook-like thing which looks like a beak. So again, it has an upper end, a lower end, and then the shaft. As you notice, the upper end is much larger compared to the lower end. The upper end has a lot of processes. The beak is known, this part, this hook-shaped process is called the olecranon process. And this part here, which is the lower end of the C, this area is known as the coronoid process. And below the coronoid process, this area is called the tuberosity of the ulna. This notch is the trochlear notch, and this is what articulates with the humerus. So this is where it articulates with the humerus. This is the shaft of the ulna. Its lateral border is the interosseous border. At the lower end, this is the head of the ulna, and this is the styloid process. So, head of the ulna and styloid process. The body on its lateral aspect has an interosseous membrane, and this interosseous membrane is parallel to the one on the radius. At its lower end, the ulna is rather small. It has a head, and then we have a styloid process. The head articulates with the ulnar notch of the radius, and together they form the inferior radio-ulnar joint. The ulna does not participate in the wrist joint, and that's important to remember. Now let's look at the bones of the wrist. So when you look at the bones of the wrist, you have the carpal bones, the 8 carpal bones. A proximal and a distal row, 5 metacarpals counted from the thumb being the first and the little finger being the 5th metacarpal, the phalanges, 2 for the thumb and 3 for the other fingers. In the carpal bones, the proximal row from lateral to medial side, we have the scaphoid, lunate, triquetral. This is the triquetral, and sitting on top, the pisiform. The distal row trapezium, trapezoid, this is the trapezoid, the capitate, this big one, and hamate. And look at this hook of the hamate. You can see the hook from the side here. This is the hook of the hamate. If you look at the metacarpals, they again have two ends and a shaft. The distal ends are known as the heads of the metacarpals, and they articulate with the phalanges, forming the metacarpophalangeal joint, and that's the area where you have the knuckles. So the metacarpophalangeal joint is at this point. And then the phalanges articulate with each other to form proximal and distal interphalangeal joints. Now, in the articulated upper limb, again you can see how the humerus articulates with the scapula at the glenoid cavity, forming the shoulder joint. Then here we have the trochlea and the capitulum of the humerus articulating with the trochlear notch and then the head of the radius, and this forms the elbow joint. And at the same time, the ulna and the radius articulate with one another here, forming the proximal radio-ulnar joint. And that really kind of gets included, the synovial membrane is included with that of the elbow joint. At the distal aspect, the radius and ulna again articulate with one another, forming the distal radio-ulnar joint. And then we have the radius articulating with the proximal carpal bones, the scaphoid and the lunate, mainly, to form the wrist joint. Then here, of course, we have the metacarpophalangeal and the interphalangeal joints. Now, what I'd like to do is go over some common mistakes that students make while they attempt the unit test. They often mistake bones of the upper limb for bones of the lower limb and vice versa. And so I'm going to show you how to avoid some of these mistakes. So let's compare them. This is the humerus and this is the tibia. Look at them. They look totally different. The humerus has this round projection. The tibia is flat across, and plus it has this tuberosity. This is at the upper end. Look at the lower end of both bones. See the humerus. The lower end of the humerus is flattened out with projections on each side. Plus it has this trochlea and the capitulum. Compare this to the tibia. Look at the tibia. It just has this one hook-shaped process, the medial malleolus. There's nothing on this side, on the lateral side. So again, use these two, compare these two, and see how different they look. So you should not confuse a humerus with a tibia. The other two bones that students confuse are the ulna and the fibula. First of all, the ulna has this very typical, if you look at this way, you can see the C. If you look at it on the side, the C is even clearer. If you look at the lower end, notice how you have this little projection, the styloid process. Compare this to the fibula. This is the fibula. The upper end of the fibula is very different. It doesn't have a C. Compare it to the lower end. The fibula has a projection at the lower end, but the projection is not so sharp. In the styloid process of the ulna is different. It looks like a little comma, and here it's flat. So you shouldn't confuse the ulna with the fibula. This is the fibula, this is the ulna. The other bone is the clavicle. Notice the clavicle, you see how this is, it's got this kind of, if you look at it this way, it's very different. And this way, can you see? So it's got this curve. And this is the rib. The rib is confused with the clavicle. The rib is very, very different. One very prominent feature of the rib, you can see that it doesn't have one of those S-shaped curves. Plus, at this end, you have this costal border. So with a large rib, you should not confuse the clavicle. And even if the rib is really small, this is the 12th rib, it's very small. Compare this to the clavicle. There, the clavicle is so much thicker, the rib is so much smaller. Plus, this clavicle has this S-shaped form, which is so typical of the clavicle. So you should not confuse the clavicle and the rib. So if I put both together, should not confuse them. They look totally different. So, having looked at these bones, you shouldn't make a mistake between the clavicle and the rib and, of course, the other bones that I've discussed. I hope this video has been useful to you and you will look at it more than once, and I assure you, if you do that, you will not have any problems in your unit test.